Malaria continues to be a leading cause of death in Uganda, particularly affecting children under the age of 5. In 2022, Uganda contributed 5.1% of global malaria cases, making it the third highest contributor globally.
So in Uganda, we live and stay and work with malaria. All of us are at risk, although some groups are at higher risk.
Uganda's decision to introduce the R21 matrix malaria vaccine is a result of years of research and advice from global health bodies. The World Health Organization pre-qualified the vaccine in July 2022, giving countries like Uganda the green light to integrate it into their national health systems.
By highly endemic, it means that your country has malaria throughout, all the time. You have malaria with you. It doesn't happen at certain times.
However, the Ministry of Health has emphasized that the vaccine rollout is a key strategy in Uganda's long-term goal of a malaria-free country by 2040.
We know that poverty and malaria are twin brothers. Poverty worsens malaria and malaria worsens poverty. So for us to become better or richer, we need to eliminate malaria.
The vaccine is set to be administered in 4 doses, starting at 6 months of age.
And then the first 3 doses will be given every month. So that's why you see here, we are giving the first dose at 6 months and giving the second dose at 7 months and giving the third dose at 8 months. Then we give the fourth dose at 1.5 years.
Once children complete this schedule, they are expected to have developed a strong immunity against malaria. While the vaccine is seen as a game changer, the rollout will be phased. Uganda plans to start in the vaccination program 105 districts, focusing on regions with the highest malaria burden.
Most likely, since it has come into routine immunization, a time will come when the vaccine is available actually across all districts. Although the biggest beneficiaries are those ones who are registering the highest burden of malaria.
Dr. Michael, a leading figure in the malaria vaccine project, explains that the decision to start in high-burden areas was strategic. Regions such as Kigezi and the Kampala metropolitan area will be incorporated into the program in later phases as more vaccines become available. The vaccine rollout is scheduled to begin in April 2025. It is expected to be integrated in Uganda's routine immunization schedule, ensuring that parents can easily access it at health facilities and through community outreach programs. According to ministry officials, Uganda is borrowing a leaf from Kenya, Malawi, and Ghana, who have already implemented malaria vaccine programs with promising results.
And good thing we had an opportunity to hear from these 3 countries. There's a set of countries that introduced around 4 years ago. We had the opportunity to listen to them. And like Jen said, what was important was listening to the community and how they appreciated the vaccine in terms of the fewer visits they have had to make to the health facilities, the fewer times their children have had to be admitted. So for them, they were no longer actually being convinced about the vaccine. They had already seen its effects.
While the vaccine has been hailed as safe and effective, parents may still have concerns about side effects. Experts reassure that most children will only experience mild symptoms after the injection, such as slight fever or swelling at the injection site. More importantly, parents need to ensure that their children complete the full vaccine schedule. Missing a dose could reduce the vaccine's effectiveness, leaving children vulnerable to malaria. The Ministry of Health is also preparing for a comprehensive communication campaign to inform the public about the vaccine's benefits, side effects, and availability.
We need to communicate, we need to advocate to media, to the community. These are ongoing, but because they are not completed, like what we are doing right now is part of that. We need to talk to engage community-based organizations, because remember, these children are in the community. That's where we're supposed to get them.
Lydia Feli Akulu, NTV.